Okay. All right. Hi, Taylor. My name is Christy. I'm a provider here in the Occupational Health Clinic. First off, I'd like to welcome you to our organization. And today we're going to be completing your comprehensive health history interview. Okay, if I can just have you verify your name and date of birth.
Taylor Merrick, 2/21/2002.
Perfect. So, with the comprehensive health history interview, what we're doing, we're just gathering some information regarding your past history, current health, medical problems, and then if you have any questions, we'll go through that at the end. So, to start out, can you just kind of tell me a little bit about yourself?
I'm 22. I work at sorry,
That's
what am I
okay.
supposed to say?
Whatever.
Okay. Well, I worked at McDonald's ever since I was like 14. I just completed nursing school, but then I realized that wasn't for me. So yeah,
Okay.
that's me.
Oh, good. So, you're here today to establish care, is that right?
hmm
All right. Any current health concerns or illnesses that you have?
Nope.
Okay. So we'll take a look at your medication history. What medications are you currently taking?
Just a prenatal vitamin.
Okay. Do you take that daily?
Yes.
And are you currently pregnant
No.
or? Okay, just taking that. Are you trying to conceive?
Yeah.
Okay. And any concerns with that vitamin at all?
Nope.
All right. You're comfortable buying it over the counter or do you need a prescription?
Nope. I'm good.
Okay. So taking a look at allergies, any medical or medications that you're allergic to?
Nope.
Any seasonal allergies?
Nope.
Any food allergies?
Nope.
All right. Can you tell me a little bit about your past medical history?
I don't really have much. Sometimes my ears get dry, like behind them, but other than that, I'm pretty healthy.
Okay. And are your ears currently dry?
Sometimes yes, but I have like an ointment. I don't remember exactly what it's called. Otherwise, I use like Aquaphor too. So,
Okay.
um,
Does the Aquaphor seem to help?
yeah,
And then you said you have an ointment. Is that by prescription?
yes.
Okay.
For my last provider, I don't remember what it is though.
Okay. So that'll be something that we'll want to get on file just so
Okay.
that if you ever did need it, or if you have a flare up, you could always come in and we could evaluate at that time. All right. And you said no concerns or illnesses today. Looking into your childhood, do you recall having any like reoccurring ear infections or any illness that?
No, not really.
Okay. So, since you have no issues today, really there's no health maintenance that we would need to go through. Of course, though, if you do conceive, that could definitely change, although you would be seeing an OB provider. But we could do our best just to refer you and get you what you need. Have you ever had surgery?
The only thing would be like wisdom teeth, if that counts.
Sure. Any problems with that surgery at all?
My chin is like a little numb at times, or like I can't really feel like the tip of it, and it's been like that since the surgery.
Okay. Did the provider that did surgery happen to evaluate and kind of follow up on that?
I don't really remember, but it doesn't cause too many issues, so it's not a big deal.
Okay. And did you have anesthesia? Do you recall?
I believe so.
Any
Yes.
problems with anesthesia?
Nope.
Okay. So now we'll take a look at your family history. When thinking about your family, I want you to consider siblings, parents, and then grandparents for you. Okay. So I'll go through a list of diseases and you kind of let me know if anybody in the family has it, and if they do, who in the family. Any addictions,
Nope.
anxiety,
Yes, my dad.
and asthma,
No.
any birth defects,
Nope.
bleeding disorders,
Nope.
cancer,
No.
congenital heart disease,
Nope.
coronary artery disease,
Nope.
depression,
My father.
diabetes,
I do not believe so. No.
any headache or migraines,
No.
hearing loss,
No.
heart attack,
No.
high blood pressure.
I think some of my grandparents, but I'm not sure like who would.
Okay, just put grandparents question
Mm-hmm.
with a question mark, and then when we see you again or when you get that information, we could update it. High cholesterol,
Nope.
learning disabilities, malignant hypothermia,
Nope.
obesity.
Might be like my grandparents on my mom's side, possibly.
Okay.
I think
Grandma or grandpa?
grandma. I
And any other mental health problems aside from anxiety or depression?
Nope.
Seizures?
Nope.
Stroke?
Nope.
Thyroid, either hyper or hypo?
Nope.
All right. Anything else that you can think of that I should know about past medical?
My dad has PTSD. I don't know if that would be like a mental health problem.
Sure. Absolutely. Okay. So we'll now take a look at your lifestyle, just so I can learn a little bit more about you. This will include social factors, environmental factors, your diet, and then some personal factors as well. So thinking about social history, what is the highest grade of your level or your highest level of education?
Associate's degree.
That you had your nursing
Yep.
degree? Okay. Congratulations. That's not a easy thing to do.
Thank you.
Any interests and hobbies that you pertain in or are active in?
I like to take walks outside. And hiking is something I want to get more into.
Good. What do you like to do in your free time aside from walks and hiking?
I like to hang out with my husband and family.
Okay. You have a good relationship with your husband and family?
Yep.
Good. Do you travel?
Yes, I like to travel.
Do you travel just domestically or internationally?
Just domestically right now.
All right, so some environmental factors we kind of touched on already, actually. You said that you work at McDonald's. You've been there since you were 14. So, do you come in contact with any chemicals or any like equipment that could cause harm there?
Not really.
Okay, perfect.
Good.
Taking a look at, let's see, tobacco use. Do you use tobacco products? Have you ever? Okay. And how about alcoholic beverages?
That I guess like maybe once a week, depending, like
Okay.
a glass of wine or something.
Like once weekly?
Mm-hmm.
Okay. And do you ever, or have you ever used any illegal or prescription medications that were not being used properly?
Nope.
Okay. And then if we could talk a little bit about your diet and exercise, tell me a little bit about your eating patterns and habits.
So since I work at McDonald's, I do tend to eat there quite a bit, because I get free food from it. So
Sure.
that'd be my biggest struggle.
Okay. Do you, I guess, what are you ordering on a typical day? Like fried foods or?
I eat like hamburgers,
Okay.
sometimes fries. So
Sure.
it's not like the worst option, but there's not great options there. So
Yeah. Have you ever thought of taking a lunch or just that
yeah,
convenience?
but then I have to pay for it, so
Sure.
it's free.
Okay. Okay. Fair enough. So on your days off of work, what does that look like for your diet?
I guess that kind of depends too. Sometimes I'll like not eat breakfast or lunch, and then just kind of, just like eat random things here and there. So
Okay. Daily fruits and vegetables?
I do try. Yes.
Okay, good. Are you trying to gain or lose weight right now?
Not really, no.
And so looking at processed foods, McDonald's obviously not being a great diet choice. But at home you said you eat random things. Are those coming out of a box or meals that you're preparing?
I feel like it's half and half. So like sometimes it'll be like out of a box, but I am trying to cook more as well.
Okay, good. And how many days a week would you say you do eat out?
5, since I work 5 days a week.
Okay. How much water do you drink in a typical day?
I'm trying to drink at least a gallon a day. That doesn't
Wow,
always happen.
impressive. Okay. On average, how much would you say you do get in?
I would say like half a gallon.
Okay, good. Do you consume caffeine at all?
Yeah. Probably just like one coffee a day, like 200 milligrams, I think.
Okay.
That's what most coffee is. But
Do you make your coffee at home?
no, I would get that like at McDonald's or something.
The perks of working at McDonald's. Okay. And you said you like to take walks and you like to go for hikes. Do you exercise regularly?
Yeah, I try to like 3 to 4 times a week.
Okay, good. And then aside from walking and hiking, what other exercises do you enjoy?
I just like running on the treadmill.
Okay. And you said 3 to 4 times a week. About how long of a time span are you doing those activities?
About an hour.
Okay, good. Do you have any problems with sleeping?
Nope.
No, no problems falling asleep, staying asleep? Okay. How many hours a night do you typically get?
I would say like 6 to 8. Just
Okay.
depends on the night.
All right. Just looking at some personal history. You were born in the United States, correct?
Yep.
Okay. And what state were you born in?
Wisconsin.
And we talked about your highest level of education. You have your associate's degree. Perfect. Who all lives at home with you?
Just my husband.
Do you have any religious or spiritual preferences?
I'm Lutheran.
Okay. And now we'll kind of just switch over to some sexual history. Are you sexually active?
Yep.
You're trying to conceive,
Mm-hmm.
but don't want to assume here. Um, how would you describe your sexual orientation?
Straight.
Okay. And your gender identity?
Female.
Have you ever been pregnant?
Nope.
You are trying to conceive. How long have you been trying to conceive for?
Just about like 2 or 3 months.
Okay. Have you ever had a sexually transmitted disease?
Nope.
Okay. So moving right along here, we'll touch on some safety. Do you feel safe at home?
Yep.
Good. Have you ever been in a relationship where you didn't feel safe?
Nope.
Okay. Do you wear a seatbelt?
Yep.
Perfect. Do you or anyone in the home own any firearms?
Nope.
Do you use sunscreen when you're outside in the sun?
Yes.
Good. All right, so we'll switch over to just some mood and kind of feelings. How would you describe your typical mood?
Content. Happy.
Okay,
Upbeat.
good. Do you ever feel as if you're not able to cope with everyday life or stressors?
Mm-mm.
No. What do you do to kind of help alleviate any stress that you are feeling?
Just talk with like my husband or my mom with like any.
Okay. Have you, in the last 2 weeks, felt down, depressed, or hopeless?
Mm-mm.
And any thoughts of self harm or harming anybody else?
Nope.
Okay. Any concerns at all with memory?
Nope.
Um, any concerns with focus, concentration?
Nope.
Any anxiety?
No.
All right, so then the last thing here that we'll complete is just a review of systems, basically kind of going from head to toe. We already went through a lot of questions, but we're about halfway done. Okay. So just in general, any fatigue or weakness that you feel?
Nope.
Any abnormal fever or chills? Night sweats, weight change?
Nope.
Do you have pain anywhere?
Nope.
Okay. And then I know we did touch briefly on this area of just kind of your mood and cognitive thinking, but again, just to confirm, no anxiety for you. Do you ever feel like you worry for no good reason?
Mm-mm.
Okay. You said no memory problems or concentration problems, and alcohol and substance abuse. You said maybe once a week you have a beverage.
Yep.
Okay. Kind of looking at your skin, do you have any rashes?
No. The only thing would just be like the dryness in my
The dry
ears.
ears?
Mm-hmm.
Okay. And do you have that going on right now?
Nope.
No. Okay. Any hair loss for you?
Nope.
Any nail changes or concerns with your nail beds?
Nope.
Okay. Um, you said no pain overall, but just kind of thinking of like your head and neck. Any pain or any concerns?
Nope.
Any neck masses or lumps? How about like here in this area?
Nope.
No. You said no, you don't have headaches?
Nope.
Okay. Um, do you wear glasses?
Nope.
Contacts?
Nope.
Okay. Any changes that you feel you've had in your vision?
No.
Blurry vision at all? Double vision? Any eye pain?
Nope.
Redness within the eyes? Okay. And we talked about family history. There's no hearing loss within the family. Do you personally have any hearing loss?
Nope.
Do you ever hear like tingling or ringing in the ears?
Nope.
Do you ever experience any kind of dizziness or vertigo?
Mm-mm.
Any nasal discharge or drainage that's abnormal?
Nope.
Any drainage at all?
Nope.
Okay. Any nosebleeds for you?
Nope.
All right. Do you have a sore throat?
Nope.
Any like soreness or irritation to your gums or tongue?
Nope.
Swelling or bleeding of the gums ever?
Nope.
And do you suffer from bad breath?
Nope.
Dry mouth?
Nope.
Any mouth sores for you?
Nope.
All right. Looking at your chest and lungs, then, do you ever have any shortness of breath?
No.
Any cough that you experience?
Nope.
And do you snore?
I think I might sometimes. I mean,
Okay.
I don't know, but my husband
Sure.
says it.
He reports that. Okay.
Yeah.
Do you know how often? You said sometimes.
I feel like it might just be when they take like naps or something like on the couch.
Okay.
Mhm.
Okay. Do you ever wake up then feeling like you're not well rested? You're tired?
No.
No. Okay. And any daytime sleepiness where during the day you're just fighting to get through?
No, not really.
Okay. Do you ever feel like your heart is beating so fast you can like feel it or hear it?
Mm-mm.
Okay. Swelling anywhere, your hands, feet?
Nope.
No. And we talked about dizziness and vertigo, but that's a little bit different than like, have you ever felt faint, like you're going to pass out?
Nope.
Okay. Do you have any pain in your arms or your legs? No. Any cramping in your legs at all?
Nope.
Any cold or numbness to your like hands, feet, toes?
Nope.
Any discoloration to the legs?
No.
You said no to hair loss, but talking specifically on your legs, have you noticed any hair loss?
Nope.
And any abdominal or back pain?
Nope.
Okay. Um, so moving on to the breast and like your underarm area, any breast lumps or masses?
Nope.
Do you perform monthly breast exams?
Yep.
Good. And no, any breast pain or discomfort?
Nope.
Any nipple discharge?
Nope.
Okay. Thinking of your abdomen then, any pain there?
Nope.
Any diarrhea or constipation for you? Reflux or heartburn?
No.
Loss of appetite, nausea?
Nope.
And vomiting?
Nope.
Okay. Any difficulty when swallowing?
Nope.
Any changes in your bowel pattern?
Nope.
How often do you have a bowel movement?
I would say like once a day.
Okay. And it's soft, easy to pass?
Mm-hmm.
Okay. Any jaundice or yellowing of the skin that you've noticed?
Nope.
All right. How old were you when your period first started?
I believe I was 15.
Okay. And do you recall the first day of your last menstrual period?
Can I check quick?
Sure.
Okay. It was the 23rd of March.
Do you have regular monthly periods?
Yes.
Yeah. Okay. Any abnormal bleeding?
Nope.
Any pain with your period?
I mean, just normal cramps, but
Okay. You take Tylenol, ibuprofen,
yeah.
and that helps?
Yep.
Okay. Any pelvic pain, vaginal pain, discharge, dryness, any concerns?
Nope.
Okay. And then we already touched on the trying to conceive part there. So looking at then like your rectal area, and we talked about no changes in bowel pattern. You go once daily. Um, you don't have to strain. Any blood in the stool?
Nope.
Pain with having a bowel movement?
Nope.
Any rectal bleeding, pain, or tenderness? Any warts, lumps, or bumps to the rectal area?
Nope.
Okay. And then do you experience any joint pain ever?
Nope.
We talked about no neck pain, arm and leg pain. What about your back?
Nope.
Okay. Even because you're working at McDonald's, you're standing and no back pain.
No.
Okay, good. We talked about you do not have headaches, but kind of looking at the nervous system as a whole, we'll just review again here. You had said no dizziness or lightheadedness, no weakness, numbness, abnormal sensation, and no fainting, you had said. Any seizure activity like tremors or involuntary movements?
Nope.
Any confusion?
Nope.
You said you don't have memory problems, but do you ever have memory loss at all?
Nope.
Any troubles ever with speaking?
Nope.
And you said you don't have any vision loss and no double vision.
Nope.
Okay. So congratulations. Overall, you seem like a really healthy 22-year-old. Do you have any questions?
I don't think so.
All right. So thank you for your time today. Welcome to our organization. And then just know that I'm available if you do have questions, concerns, or if you need referrals to any other provider.
Okay,
Okay.
thank you.
Thank you.